Have you ever heard your baby crying in the dead of night and felt their forehead only to discover they're burning up? Are you wondering, does this count as a fever? What should I do? Why do newborns get fevers? Don't worry, today I will answer these questions and help you handle this tricky situation with ease. Hello everyone, welcome to my channel. I'm Sophia. In today's video, we will discuss a topic that makes every new parent feel anxious: newborn fevers. I will reveal the truth about newborn fevers and help you quickly judge and manage the situation. Isn't it true that every parent feels a bit panicked the first time they see their baby's temperature rising? Are you wondering whether you should take them to the hospital immediately or just monitor them at home? First, we need to clarify that a newborn's normal temperature range is typically between 36.5 degrees Celsius and 37.5 degrees Celsius. If the temperature exceeds 37.5 degrees Celsius, it can be considered a fever. At this point, you might be asking yourself, is this temperature serious? How do I determine the next steps? Don't worry. First, we should understand what causes fever. When faced with a baby's fever, many parents often wonder, what causes it? There are many potential reasons for a newborn's fever, with viral infections being the most common. When viruses invade the baby's body, their immune system responds by raising the temperature to fight off the virus. It's like a little battle where the baby is using their own way to combat germs. What other common causes of fever should we be aware of? Other common causes include bacterial infections, reactions to vaccinations, or overheating due to wearing too many layers. Did you know that overdressing can make your baby uncomfortable and trigger a fever? If you find yourself overdressing your baby out of concern for them getting cold, be sure to maintain a comfortable room temperature to prevent overheating. Of course, there are some situations that require more caution. If the baby has a persistent high fever or shows other serious symptoms like continuous crying, rapid breathing, or red skin or rashes, these are signals that need immediate attention. At this point, you might be considering whether you need to seek medical help quickly, right? Many parents often ask, can I just touch my baby's forehead to see if they have a fever? How accurate is this method? In fact, just feeling with your hand is not sufficient. The most reliable way is to use a thermometer for measurement. Ear thermometers, axillary temperature, and rectal temperature are common measurement methods. Here, I strongly recommend using an ear thermometer, as it is quick, convenient, and causes minimal discomfort for the baby. If you find that your baby's temperature exceeds 37.5 degrees Celsius, especially if it reaches 38 degrees Celsius or above, this is a point of concern. Are you curious about how to better interpret these temperature readings? For instance, a temperature between 38 degrees Celsius and 39 degrees Celsius is considered mild to moderate fever, while anything above 39 degrees Celsius is categorized as a high fever. The approach to managing different temperature ranges also varies. For many parents, is a higher fever always more dangerous? Generally, a temperature between 38 degrees Celsius and 39 degrees Celsius can be considered a mild fever, but this doesn't mean you should take it lightly. In fact, this is when we need to monitor closely. If your baby's temperature hovers around 38 degrees Celsius, you can help them reduce the fever using physical methods, like wiping their forehead and armpits with lukewarm water. Just remember, never use cold water, as it might cause a sudden drop in temperature, putting extra strain on their body. But if your baby's temperature exceeds 39 degrees Celsius, or if they show other symptoms like lethargy, loss of appetite, or excessive crying, you should seek medical help quickly. Are you wondering how doctors assess your baby's symptoms? Usually, the doctor will evaluate based on specific symptoms to decide if medication or other treatments are necessary. So, before we head to the hospital, what simple methods can we use at home to help reduce a baby's fever? One common method is physical cooling. It's important to avoid using ice packs or cold towels, as this can cause the baby's temperature to drop too quickly, putting extra strain on their body. Wiping with lukewarm water is a safer choice. Another method is to keep the baby's environment comfortable and at a moderate temperature. Dress the baby in lightweight clothing and ensure the room is well ventilated. If you notice the baby's temperature rising, do not bundle them up too much or cover them tightly, as this can lead to higher temperatures. Do you think keeping the indoor air circulation good helps in the baby's recovery? While helping to reduce the fever, staying hydrated is also crucial. Adequate fluid intake helps maintain the baby's hydration balance and prevents dehydration. If the baby is still breastfeeding, breast milk not only provides nutrition, but also helps keep the baby hydrated. Therefore, ensuring the baby receives enough fluids is essential. Many parents may ask, should we immediately give the baby fever-reducing medication if they have a fever? In fact, administering fever medication to newborns requires great caution. Doctors often recommend certain child-specific fever medications like ibuprofen or acetaminophen, but the dosages must be very precise. An overdose can harm the baby. Are you wondering how to ensure your baby safely takes medication? Before giving any medication to your baby, it's advisable to consult a doctor first. Especially for newborns, fever can sometimes be a natural response of their body fighting off an infection and may not require immediate medication. If the baby is in good spirits and has a normal appetite, parents can first try physical methods to lower the temperature and observe the baby's response, consulting a doctor later if medication is necessary. Lastly, when should a fever require immediate medical attention? Typically, if the baby's temperature exceeds 39 degrees Celsius and remains high, or if the baby shows severe symptoms such as rapid breathing, extreme lethargy, or inability to eat normally. These are signals that necessitate immediate medical care. Do you know about the special considerations for babies under 3 months old? For such babies, regardless of the fever level, it is advisable to consult a doctor early. Newborns have immature immune systems, and even minor infections can escalate quickly. Therefore, it is essential to take timely action when dealing with a baby's fever. For many parents, understanding this information can not only reduce anxiety, but also enable them to make the right decisions at critical moments. Of course, we cannot completely avoid fevers in babies, but we can take some measures to reduce their incidence. First, ensure that the baby's clothing and room temperature are appropriate, avoiding overdressing or underdressing. Did you know that good hygiene practices can help reduce the chance of infections? Washing hands frequently and limiting exposure to public places or sick individuals are very effective preventive measures. Additionally, breastfeeding can help boost the baby's immune system, so ensuring that the baby receives enough breast milk can lower the risk of infections to some extent. Furthermore, regularly taking the baby for health checkups, getting vaccinations on time, and maintaining overall good health are also important measures for preventing fevers. Well, that's all for today's sharing. I know that many parents feel very anxious when facing a baby's fever, but as long as we grasp the correct knowledge and coping methods, we can respond calmly and provide the best care for our babies. I hope today's sharing helps you gain a clearer understanding of your baby's fever and feel more prepared. If you liked today's content, don't forget to give me a thumbs up and subscribe to my channel. See you in the next video. More practical parenting knowledge awaits you.